Hi, this is a presentation about spinal cord injury. So your spinal cord is part of the CNS, central nervous system, and it relays sensory and motor information. It's essentially a long tube of nervous tissue, and these are protected by a vertebrae, and these form a column, which would be your spine. So normally your spinal cord is located within the vertebrae, as you can see here, and this can be divided into 31 segments with nerves coming out of each segment. And these segments can be broken down into 4 plexuses or regions, as you can see here. And each segment is responsible for communication to a specific organ or area of the body. So for example, your phrenic nerves are responsible for diaphragm control for breathing. So just to appreciate the complexity of the spinal cord, here's a peripheral nerve, and here are the tracts, of which they pertain to a different function, and there are 31 peripheral nerves connecting to these tracts. So a healthy spinal cord might look something like this, with continuous nerve cells, a standard composition of cell types, and healthy neurons. So for example, myelin sheaths are present and Nisl bodies are present. So spinal cord injury refers to when you damage your spinal cord, either from traumatic, so such as car accidents, or non-traumatic, such as cancers. So it often results in loss of control or sensation in parts of your body. So for example, your phrenic nerves, which control your diaphragm, if they're cut, your ability to breathe is impaired or lost. So there are many different ways to classify spinal cord injuries. So first would be complete injury, where you lose complete sensation or voluntary movement, and there's also incomplete injury, where there's limited sensation and voluntary movement. There's also primary injury, which is acute after injury, and there's secondary, which is caused by your primary injury, so it'd be your immune response to it. So when your spinal cord is damaged, many changes happen, so histological, chemical, scarring, and functional. So for example, your healthy spinal cord up here becomes scarred and it becomes discontinuous in nerves, and your neurons start to lose their myelin sheaths and the initial body start dissolving. So a metaphor for you having a complete spinal cord injury is how your home is connected to the power grid, but if a storm were to cut and sever this line, you would lose full electrical connectivity. This is akin to how your central nervous system controls parts of your body through the spinal cord. So, for instance, if you were to experience a break in your spinal cord at the phrenic nerves, you would lose your ability to breathe, plus other functions below this. So some interesting facts about this in terms of population is that this mainly affects young people. So 38.5% of SCIs are between the ages of 16 and 30, and it's more prevalent in males too, so around 80%. Automobile crashes and falls are also the main causes of spinal cord injuries, but interestingly, elderly falls account for 75% of the age bracket spinal cord injuries. So if we were to identify trends to identify populations at risk, one would be people who commute using personal vehicles are at risk of spinal cord injury, elderly people are at risk, and being a male puts you at risk. However, this is a complex issue and there may be many more factors at play here. So for prevalence in Australia, around 20,800 people live with SCIs, mostly under the age of 65. For these cases, 80% were mainly men in road accidents. Though road accidents and falls actually only make 82% of traumatic SCIs, as you can see there are others. 41% of the total number were from non-traumatic incidences, so stuff like tumours and degenerative disorders. An incidence rate in Australia is around 15 per million people as of 2013. However, no yearly rate has been provided by an authority. So for instance, between 2020 and 2021, 27,000 people were hospitalized for spinal injuries. However, this definition is very broad and not only includes spinal cord injuries, but also just spine damage and peripheral nerve damage. So for the treatment of SCIs, you want to treat this as soon as possible. So immediately after the injury, you want to immobilize the site to stabilize it, and you want to diagnose the condition, and then think about prescribing surgical intervention, such as surgical fixation, which we will discuss next. Just a content warning, the next slide will have some gruesome medical images. So as introduced before, surgical fixation is one way to treat spinal cord injury. So this would involve the fusion of vertebrae through a bone graft fastened by metal hardware. It's very risky as many other organs and bodily systems are involved. So here's a patient, a 20-year-old male, fell and received a complete spinal cord injury below the T6 level. His treatment involved instrumented fusion, as you can see here. Fortunately, the surgery was successful, however the patient now has complete paraplegia, that is, loss of lower limb control. So for the management of spinal cord injuries, there are various medical, surgical, and rehabilitative solutions. So a case study for respiratory conditions would be being prescribed a mechanical ventilation device. For surgical, tracheostomy surgery. Rehabilitative, you might be put in a respiratory conditioning program. For dermatological conditions, you might be prescribed pressure ulcer medications or support surfaces. Surgical, pressure ulcer repair. And for rehabilitative, the habit of avoid laying in the same position for long periods of time, or the redistribution of pressure. So there are three types of methods of preventing spinal cord injury. So there's a primary method, which is to stop a disease or disability from occurring in the first place. Secondary, which is identifying and stopping an asymptomatic disease or disability. And tertiary prevention, which would be eradicating a disease or disability when symptoms are already present. For simplicity's sake, we're only going to be focusing on the primary method of prevention. So some primary prevention methods for reducing SCI would be driving related. So wear a seatbelt, go at the correct speed limit, avoid drugs and alcohol before driving to avoid impairment. Another would be fall related, so hold on to handrails when climbing stairs, clean up spills quickly as possible, and ensure the floor is free from trip hazards. Install safety railings when possible. And for sports related prevention methods, never shove people in water, do not dive into shallow water, and wear helmets when riding bikes and other similar devices. And here are my references.